Welcome! Today, we're diving into the basics of ultrasound, what it measures, and how to interpret the results. Ultrasound is a widely used medical imaging technique that employs high-frequency sound waves to create images of structures inside the body. It's non-invasive, safe, and provides real-time information, making it a preferred choice for many diagnostic purposes. Whether you're curious about how ultrasounds work or what your doctor is looking for during a scan, this video will break down the essentials in a clear and approachable way. Let's start by understanding the fundamental principles behind ultrasound technology. Ultrasound, also known as sonography, uses sound waves that are above the range of human hearing. These waves are sent into the body using a small device called a transducer. As the sound waves bounce off tissues, organs, and fluids, they create echoes. The ultrasound machine then interprets these echoes to form detailed images on a screen. This process allows healthcare professionals to visualize internal structures without the need for surgery or exposure to ionizing radiation, like X-rays. Ultrasound is commonly used in many areas of medicine, from monitoring pregnancies to diagnosing organ issues. Let's take a closer look at how ultrasound actually works. The transducer emits sound waves into the body, which travel until they hit a boundary between different tissues, like fluid and soft tissue, or soft tissue and bone. Some of these waves are reflected back to the transducer, while others continue deeper. The machine measures the time it takes for the echoes to return and their strength, constructing a visual map of the area being examined. This real-time feedback is especially useful for observing movement, such as a beating heart or blood flow in vessels. Ultrasound isn't a one-size-fits-all tool. There are several types of ultrasound exams, each tailored to specific medical needs. For example, abdominal ultrasounds look at organs like the liver, kidneys, and gallbladder. Pelvic ultrasounds are often used to examine reproductive organs. There are also specialized ultrasounds, such as Doppler studies, which assess blood flow, and echocardiograms, which focus on the heart. Each type uses the same basic technology, but is optimized for different parts of the body and clinical questions. Ultrasound is incredibly versatile. In obstetrics, it's used to monitor fetal development and check for potential complications during pregnancy. In cardiology, it helps visualize the heart's structure and function. Ultrasound can also detect gallstones, kidney stones, liver disease, and even guide procedures like biopsies. Its ability to provide real-time images makes it invaluable for both diagnosis and treatment planning. The safety and convenience of ultrasound have made it a staple in clinics and hospitals worldwide. At its core, ultrasound measures the reflection of sound waves off different tissues. This allows it to determine the size, shape, and consistency of organs and structures. It can also detect abnormal masses, such as tumors or cysts, and identify fluid collections. In Doppler ultrasound, the technology measures the movement of blood through vessels, helping to assess blood flow and detect blockages or clots. These measurements are crucial for diagnosing a wide range of conditions and monitoring ongoing health issues. When you look at an ultrasound image, you're seeing a grayscale picture where different shades represent various tissue types. Fluid appears black because it doesn't reflect sound waves, while dense tissues like bone appear white due to strong reflection. Soft tissues show up in shades of gray. Interpreting these images requires training, but the basic idea is that the brightness and shape of structures help doctors identify normal anatomy and spot abnormalities. A core concept in ultrasound interpretation is echogenicity, which refers to how much sound a tissue reflects. Tissues that reflect a lot of sound, like bone, are called hyperechoic and appear bright. Those that reflect little sound, like fluid, are hypoechoic or anechoic and appear dark. Understanding echogenicity helps doctors distinguish between different types of tissues and identify potential problems. The transducer is the handheld device that sends and receives sound waves during an ultrasound exam. It comes in various shapes and sizes, each designed for specific types of scans. For example, a curved transducer is often used for abdominal scans, while a linear one is used for vascular studies. The choice of transducer affects the depth and resolution of the images produced, allowing for tailored examinations based on the clinical need. Preparation for an ultrasound exam depends on the area being examined. For abdominal scans, you might be asked to fast for several hours to reduce gas and improve image quality. For pelvic ultrasounds, a full bladder can help provide clearer images. Generally, you'll be asked to wear comfortable clothing and may need to change into a gown. The procedure itself is painless and usually takes less than 30 minutes. During an ultrasound, a clear gel is applied to your skin to help the transducer make secure contact and transmit sound waves efficiently. The technician moves the transducer over the area of interest, capturing images in real time. You might be asked to change positions or hold your breath briefly to get better views. The process is generally comfortable, and you can communicate with the technician if you have any concerns. Once the ultrasound is complete, the gel is wiped off, and you can resume normal activities immediately. There's no recovery time needed. The images are reviewed by a radiologist or your doctor, who will interpret the findings and discuss the results with you. In most cases, you'll receive your results within a few days, unless it's an emergency situation where immediate feedback is necessary. Ultrasound results can reveal a lot about your health. They can confirm normal anatomy, detect abnormalities like cysts or tumors, identify fluid collections, and assess organ function. In pregnancy, ultrasounds monitor fetal growth and development, check for multiple pregnancies, and evaluate the placenta. In other cases, they can help diagnose infections, blockages, or injuries. The clarity and detail of the images help guide further testing or treatment if needed. A normal ultrasound result means that the organs and tissues appear as expected, with no signs of disease or abnormality. Abnormal findings might include masses, unusual fluid collections, or changes in organ size or shape. Sometimes, further tests are needed to clarify what an abnormality means. Your doctor will explain the significance of any findings and recommend next steps if necessary. While ultrasound is a powerful tool, it does have limitations. It can't always see through bone or air-filled structures, which is why it's less useful for imaging the lungs or brain in adults. Obesity or excessive gas can also reduce image quality. In some cases, other imaging methods like CT or MRI may be recommended for a more complete evaluation. One of the biggest advantages of ultrasound is its safety. Unlike X-rays or CT scans, ultrasound doesn't use ionizing radiation, making it safe for repeated use and for sensitive groups like pregnant women and children. Decades of research have shown no harmful effects when used appropriately. This safety profile is a major reason why ultrasound is so widely used in medicine today. Doppler ultrasound is a special technique that measures the movement of blood through vessels. By analyzing changes in the frequency of sound waves as they bounce off moving blood cells, Doppler ultrasound can show the speed and direction of blood flow. This is particularly useful for detecting blockages, narrowing of vessels, or abnormal blood flow patterns, which can indicate various cardiovascular conditions. An echocardiogram is a type of ultrasound focused on the heart. It provides detailed images of the heart's chambers, valves, and blood flow. Doctors use echocardiograms to assess heart function, detect structural abnormalities, and monitor conditions like heart failure or valve disease. The test is painless and provides crucial information for managing heart health. Pregnancy ultrasounds are among the most common uses of this technology. They help monitor fetal growth, check for multiple pregnancies, and assess the health of the placenta and amniotic fluid. Ultrasound can also detect certain birth defects and provide reassurance about the baby's development. These scans are safe for both mother and baby and are a routine part of prenatal care. Abdominal ultrasound is used to examine organs such as the liver, gallbladder, pancreas, kidneys, and spleen. It can detect gallstones, liver disease, kidney stones, and other abnormalities. This type of scan is non-invasive and provides valuable information for diagnosing digestive and urinary tract issues. Pelvic ultrasound is commonly used to evaluate reproductive organs in both men and women. In women, it examines the uterus, ovaries, and fallopian tubes, helping diagnose conditions like ovarian cysts, fibroids, or ectopic pregnancies. In men, it can assess the bladder and prostate. This scan is essential for investigating pelvic pain, abnormal bleeding, or infertility. Musculoskeletal ultrasound is used to visualize muscles, tendons, ligaments, and joints. It's helpful for diagnosing injuries like tears, sprains, or inflammation. This type of ultrasound is often used in sports medicine and orthopedics to guide treatment and monitor recovery. It's a quick, non-invasive way to assess soft tissue problems. Vascular ultrasound focuses on blood vessels, helping to detect blockages, clots, or narrowing. It's commonly used to assess arteries and veins in the neck, arms, and legs. This scan is vital for diagnosing conditions like deep vein thrombosis or carotid artery disease, which can have serious health implications if left untreated. Thyroid ultrasound is used to examine the thyroid gland in the neck. It helps detect nodules, cysts, or enlargement of the gland. This scan is often performed when there are symptoms like a lump in the neck or abnormal thyroid function tests. It's a quick and painless way to assess thyroid health and guide further management if needed. Breast ultrasound is often used alongside mammography to evaluate lumps or abnormalities found during a physical exam or screening. It helps distinguish between solid masses and fluid-filled cysts, guiding decisions about further testing or biopsy. This scan is especially useful for women with dense breast tissue, where mammograms may be less effective. Ultrasound is frequently used to guide medical procedures, such as biopsies or fluid drainage. By providing real-time images, it helps doctors accurately target the area of interest, reducing the risk of complications and improving the success of the procedure. This guidance is especially valuable for procedures involving delicate or hard-to-reach structures. Ultrasound reports often include measurements of organs, masses, or fluid collections. These measurements help doctors track changes over time and compare findings to normal ranges. For example, an enlarged liver or kidney may indicate disease, while a shrinking cyst could show improvement. Accurate measurements are essential for monitoring progress and making informed treatment decisions. A cyst is a fluid-filled sac that can develop in various parts of the body. On ultrasound, cysts usually appear as dark anechoic areas because they don't reflect sound waves. Most cysts are benign, but their size, shape, and location help doctors decide if further evaluation is needed. Ultrasound is the preferred method for identifying and monitoring cysts. A tumor is an abnormal growth of tissue that can be benign or malignant. On ultrasound, tumors may appear as solid masses with varying echogenicity, depending on their composition. The shape, borders, and internal characteristics of a mass help doctors assess the likelihood of cancer and determine if a biopsy is needed. Ultrasound is a valuable tool for detecting and evaluating tumors. Ultrasound is excellent for detecting fluid collections, such as abscesses, hematomas, or ascites. These appear as dark areas on the scan and can be measured for size and location. Identifying fluid collections is important for diagnosing infections, injuries, or chronic conditions, and ultrasound can guide drainage procedures if needed. Doppler ultrasound allows doctors to assess blood flow in arteries and veins. It can detect reduced or blocked flow, which may indicate clots, narrowing, or other vascular problems. The direction and speed of blood flow are displayed in color or as waveforms, providing detailed information about circulation and helping guide treatment decisions. Artifacts are features on an ultrasound image that don't represent actual structures. They can be caused by technical factors, patient movement, or the way sound waves interact with tissues. Common artifacts include shadowing, enhancement, and reverberation. Understanding artifacts helps doctors avoid misinterpreting the images and ensures accurate diagnosis. In emergency settings, ultrasound is used for rapid assessment of trauma, internal bleeding, or organ injury. The fast, focused assessment with sonography in trauma exam is a quick scan to check for free fluid in the abdomen or chest. This can help guide immediate treatment decisions and improve patient outcomes in critical situations. Advances in technology have led to the development of portable ultrasound devices. These compact machines can be used at the bedside, in ambulances, or even in remote locations. Portable ultrasounds provide immediate information, making them invaluable for point-of-care diagnosis and treatment, especially in resource-limited settings. Ultrasound is just one of several imaging options. Compared to X-rays, CT scans, or MRI, ultrasound is faster, safer, and often less expensive. However, it may not provide as much detail for certain tissues, like the brain or lungs. Doctors choose the best imaging method based on the clinical question, patient needs, and the strengths of each technology. Ultrasound is especially useful in children because it's safe and doesn't expose them to radiation. It's used to assess organs, detect congenital abnormalities, and guide procedures. Pediatric ultrasound can evaluate the brain in infants, check for hip dysplasia, or investigate abdominal pain, providing valuable information for diagnosis and treatment. In obstetrics, ultrasound is essential for monitoring pregnancy. It helps determine gestational age, check fetal heartbeat, and assess the position of the baby and placenta. Regular ultrasounds ensure that both mother and baby are healthy and allow for early detection of potential complications. Gynecological ultrasound is used to evaluate the uterus, ovaries, and other pelvic structures. It helps diagnose conditions like fibroids, ovarian cysts, and endometriosis. Ultrasound is also used to monitor treatment and guide procedures, such as egg retrieval, infertility treatments. Urological ultrasound examines the kidneys, bladder, and prostate. It's used to detect kidney stones, bladder tumors, or prostate enlargement. This scan is non-invasive and provides important information for diagnosing urinary tract problems and planning treatment. In oncology, ultrasound helps detect and monitor tumors, guide biopsies, and assess response to treatment. It's often used to evaluate the liver, lymph nodes, and other organs for cancer spread. Ultrasound's ability to provide real-time images makes it a valuable tool in cancer care. Cardiac ultrasound, or echocardiography, is essential for evaluating heart structure and function. It helps diagnose heart valve problems, measure heart chamber size, and assess blood flow. This information is critical for managing heart disease and planning interventions. Gastrointestinal ultrasound examines organs like the liver, gallbladder, pancreas, and intestines. It helps diagnose liver disease, gallstones, pancreatitis, and other digestive issues. Ultrasound is a first-line tool for evaluating abdominal pain and guiding further testing if needed. Renal ultrasound is used to assess the kidneys and urinary tract. It can detect kidney stones, cysts, tumors, or signs of chronic kidney disease. This scan is non-invasive and provides essential information for diagnosing and managing kidney problems. Ultrasound can help diagnose infections by identifying abscesses, fluid collections, or organ changes. It's often used to guide drainage of infected fluid and monitor response to treatment. This makes ultrasound a valuable tool in managing infectious diseases and preventing complications. To wrap up, ultrasound is a safe, versatile, and widely used imaging technique that measures the reflection of sound waves to create images of the body's internal structures. It helps diagnose a wide range of conditions, guide procedures, and monitor treatment. Understanding what ultrasound measures and how to interpret the results empowers you to take an active role in your healthcare. If you ever have questions about your ultrasound exam or results, don't hesitate to ask your healthcare provider for more information.